Stomach and junctions. Stomach is subdivided anatomically into 4 regions: the cardiac region, fundus, body, and pylorus. Histologically, only 3 regions are distinguished based on the glands present in the lamina propria: the cardiac region, the fundic region, and the pyloric region. Gastric glands possess isthmus which connects the gland to the bottom of the gastric pit, neck, which is the middle part of the gland, base, which is the deeper part. Gastric glands are lined by parietal or oxantic cells, chief or zymogenic cells, mucous neck cells, stem or regenerative cells, enteroendocrine cells or APUD cells. Both cardiac and pyloric glands are similar, possess all types of cells except chief cells, but the base of the cardiac gland is less coiled than the base of the pyloric gland. Therefore, 2 sections of the stomach are only done: section of the fundus and section of the pylorus, together with 2 sections of the junctions, LS Gastroesophageal Junction and LS Pyloroduodenal Junction. Stomach. The wall of the stomach is composed of 4 layers. Mucosa. Epithelium is simple columnar secretory epithelium with oval basal nuclei. Corium is loose connective tissue containing blood vessels, lymphatics, nerve fibers, and gastric glands, either fundic or pyloric glands. Muscularis mucosa is formed of 2 layers, inner circular and outer longitudinal. Submucosa is a loose connective tissue containing blood vessels, lymphatics, nerve fibers, and Meissner's autonomic nerve plexus. Musculosa is smooth muscle fibers arranged in 3 layers in the fundus: inner oblique, middle circular, and outer longitudinal, and is thicker in the pylorus, formed of 2 layers: inner circular, which is thick to form the pyloric sphincter, and outer longitudinal. Erbach's or Meissner's plexus is found between the muscle. Serosa is a loose connective tissue containing blood vessels, nerves, and lymphatics, covered with mesothelium. Comparison between fundus and pylorus. For easy differentiation between fundus and pylorus, we have to consider the various layers of the alimentary canal. Mucosa. Mucosa of the fundus is darkly stained and highly folded. Mucosa of the pylorus is lightly stained and less folded. Corium. Corium of the fundus contains the fundic glands. Fundic glands are more crowded with minimal connective tissue in between. The glands are simple branched tubular, occupying the whole thickness of the mucosa, till muscularis mucosa. Gastric pits are shorter and narrow, about 1/3 of the mucosa. The glands are lined with mucus, peptic, oxantic, argentaphene, and stem cells. Corium of pylorus contains pyloric glands. The pyloric glands are less crowded with abundant connective tissue in between. Glands are coiled tubular with many branches, occupying the whole thickness of the mucosa till muscularis mucosa. Their gastric pits are deep and wide, about 1/2 of the mucosa. The glands are lined mainly by mucous cells with few argentaphene and oxyntic cells. Submucosa of the fundus is formed of loose areolar connective tissue with blood vessels and nerves. Submucosa of the pylorus is similar, loose areolar connective tissue and blood vessels and nerves. Musculosa. Musculosa of the fundus is made of 3 layers: inner oblique, middle circular, and outer longitudinal layers. Musculosa of pylorus is thicker, made of inner thick circular layer forming the pyloric sphincter and outer longitudinal layers. Then serosa. Serosa of the fundus is similar to serosa of the pylorus, formed of loose areolar connective tissue covered by mesothelium in both the fundus and pylorus. Epithelial lining the stomach. Cells having the characters of protein sensitizing cells, as surface columnar cells or surface mucous cells, with basal oval nuclei and pale cytoplasm. They secrete neutral mucus, which protects against HCl in gastric lumen and lubricates the surface. Mucous neck cells. They are located in the neck of the glands. They are low columnar cells with pale cytoplasm and basal flattened nuclei. By electron microscope, they show the usual picture of protein sensitizing cells, that is, basal located rough endoplasmic reticulum, numerous mitochondria, supranuclear Golgi apparatus, and many apical mucus secretory granules. They secrete an acidic mucin. Peptic, also called chief or central cells. They are the most numerous, located in the lower part of the glands. They are pyramidal cells with basal rounded nuclei. By electron microscope, they show the usual picture of protein sensitizing cells with secretory zymogen granules. They secrete pepsinogen and renin. Other cells are parietal or oxyntic cells. They are found scattered between the peptic cells. They do not reach the lumen of the gland. They are rounded or triangular cells with acidophilic cytoplasm and central rounded nuclei. By electron microscope, they contain few rough endoplasmic reticulum and ribosomes, as well as well-developed smooth endoplasmic reticulum for the manufacture of HCl. Many intercellular canaliculi with numerous long microvilli on the surface and numerous mitochondria. They secrete HCl and the intrinsic anti-pernicious anemia factor that helps the absorption of vitamin B12. Lack of this factor results in pernicious anemia. Other cells are APUD cells or enteroendocrine cells. They are present mainly in the base of the gastric glands. They cannot be seen in ordinary stain and needs a special stain like silver or chromium salts. They show scattered mitochondria, rough endoplasmic reticulum, and Golgi apparatus not prominent. They secrete the usual hormones serotonin, somatostatin, endorphin, as well as gastric hormones like gastrin and glucagon-like substance. Finally, there are the regenerative or stem cells. They are located mostly in the neck, isthmus, or gastric pits. They are small cells with oval basal nuclei, and they are capable of replacing all cells in the glands. Changes at the gastroesophageal junction. It is best studied by LS section. Epithelium. The stratified squamous epithelium of the esophagus is suddenly replaced by the simple columnar secretory epithelium of the stomach. Corium. It becomes thick and is occupied by the fundic glands. Musculus mucosa passes without change. Submucosa. The esophageal glands stop gradually. They may continue for a short distance in the stomach. Musculosa. It becomes thicker and is formed of 3 layers: inner oblique, middle circular, and outer longitudinal. Adventitia. Changes into serosa. Becomes covered by mesothelial layer. Changes at the pyloroduodenal junction. Mucosa. The villi start to project above the surface. The lining epithelium, columnar secreting cells of the stomach, changes to columnar absorbing cells. Goblet cells start to appear. Corium. The pyloric glands are replaced by the crypts of Lipperkin. Musculus mucosa passes unchanged. Submucosa. It becomes wider in the duodenum and contains Brunner's glands. Musculosa. The inner circular thick layer of the pylorus, pyloric sphincter, becomes thin in the duodenum, as its muscle layer is formed of inner circular and outer longitudinal.